So the fibers are very important. We're learning this because there are people who are making the mistake, unfortunately, Jesse, of eliminating those fibers. They might call it a carnivorous diet or a ketogenic diet. And the ketogenic diet is one of the few diets we have lots of evidence for. We suffer from lack of real clinical studies in diet because it's very expensive. We're not pharma. We don't exploit people for money. So we don't have a $200 billion a year budget. And so we have to hobble together our studies. So if you eliminate those fibers from your diet, weird things happen. So it's like, imagine you tie your dog up in the backyard and you didn't feed it for a week. How's your dog going to be? Dead, right? So same thing. If you don't feed the microbes the things they need, like these fibers, many species will either die off or diminish dramatically in numbers. But there are exceptions. One exception is Akkermansia muciniphila, mucus lover. So what Akkermansia does, Akkermansia is a great microbe under normal situations where you're getting some fibers. It's about 5% of your entire microbiome is Akkermansia. And it helps you control blood sugar and mood and reduce anxiety and give you better sleep. So very good. If you eliminate fibers, other microbes diminish. Akkermansia proliferates to occupy not 5% of your microbiome, but 18%, 24%, 36%, 44% becomes the dominant microbe. And it's Akkermansia muciniphila. It eats your mucus. So it leads to ulcerative colitis, small bowel inflammation, increased endotoxemia, and long-term metabolic derangements like weight gain, fatty liver, high triglycerides, diverticular disease, and colon cancer. So you don't want to neglect those fibers. And the need for those fibers is written into your genetic code. If we look at all the wild hunter-gatherer populations of the world, you'll see them digging in the dirt for roots and tubers, grabbing wild plant matter they don't know this, but they're nourishing their microbiome. So we continue that and don't make mistakes. So kids, there is a century-long experience with ketogenic diets in children who have intractable grand mal seizures. So this is a little 4-year-old who has 10 seizures a day, and she's getting brain damage from it. So mom and dad put her on a ketogenic diet, and it reduces seizure frequency by about 50%. But what happens to those kids? They stop growing. These are children. They develop osteopenia or osteoporosis. They develop kidney stones, calcium oxalate. These are kids, calcium oxalate kidney stones. They get constipated, and they get those adverse changes in their microbiome. And so we know with good evidence that a ketogenic diet, if it neglects intake of fibers, there are some people on the ketogenic diet who are getting those fibers, and that's okay. That's okay. But if you're saying, I'm just going to eat, pork chops and spinach or something like that, where you're not getting enough fiber, then weird stuff happens.
That's where I was going to go. Keto diet with having some of the lower carb veggies. Your thoughts on that? So you're saying that would be okay?
That works. There's not a lot of data on that, but logically it works. What I don't know is whether there's some adverse changes in such things as hydrogen sulfide producing microbes like D-sulfovibrio. D-sulfovibrio is a very bad microbe that probably causes colon cancer, and it proliferates when you have a meat-heavy diet. I don't know if that's sufficient to ablate the overproliferation of hydrogen sulfide producing species. That's an uncertainty.
Okay. This opens up a lot of different questions. We talked about the keto piece, but moving to carnivore, is there any studies showing what happens, even say a month on that diet where there's no fiber? You talked about the Akkermansia and how that's going to proliferate, but even in a short-term basis, would you say for 30 days, and then if they were to go back to including fiber, would you stand against that?
Nobody knows how long you must deprive your microbiome of fiber before it becomes irreversible. It's just not known. You can imagine how difficult that would be. I say, Jesse, okay, we're going to put you in the group of people who do it for 2 weeks. We're going to put you in a group of people who do it for 4 weeks, and then we do extensive microbiome analyses over time to see who can recover and who can't. So very expensive to do, very difficult, and huge amounts of data. So to my knowledge, no one has done that. Now we don't want to get confused by labels. A ketogenic diet without fiber is a carnivorous diet. So even though they sound different and different products go with it, it's essentially biologically the same. So I think we could safely assume that the diets that were ketogenic used in kids, as well as in adults, that develop ketosis, as you do on a carnivorous diet, were extremely destructive over time. The crazy thing about this, Jesse, is that in the upfront period, it lulls you into thinking it's good. Oh, my waist shrunk by 6 inches. My blood pressure went down. My triglycerides went down. My blood sugar went down. I'm clear. I have energy. Up front. Because what they did was they starved their SIBO, the microbes in the upper GI tract that were causing mind fog, fatigue, all that kind of stuff. So it's like going on a low FODMAPs diet. Just because you have less bloating and diarrhea by eliminating FODMAP, fiber and sugar, does not mean you've addressed the problem and you've righted your microbiome. So I think what I'm trying to do, Jesse, is get everyone to think a little more clearly about what they're doing. And it's always reassuring to me to think, well, how did people used to do this? Before dietary guidelines, before big food got in the way with their exploitative practices, more like what your great-grandmother did. And that's what they did. They had root vegetables, and vegetables, they would ferment things, they would can things. And when they ate an animal, no one threw the brain away or the tongue or the heart or the liver, the kidneys. You ate them. And that, by the way, provided abundant quantities of collagen, hyaluronic acid, and other nutrients largely absent from the modern diet. By the way, ladies love this. When you combine Reuteri, one of the effects of Reuteri, besides upper GI colonization, is to cause hypothalamic or brain release of oxytocin, which is incredible for skin health and other factors. When you combine Reuteri/oxytocin with collagen peptides and hyaluronic acid, you get a dramatic improvement in skin health. Ladies will say, oh, my crow's feet and smile lines are now gone. My sebum, my skin is moister, and my joints feel better because the Reuteri and collagen increase joint collagen. The hyaluronic acid increases joint synovial fluid, joint lubrication. So that's a joint rebuilding formula also. It's also a body composition modifying formula, targeting loss of abdominal visceral fat. That's the source of most of the problems associated with overweight. And restoration of youthful muscle, which is a huge advantage long-term in your health. So that combination, because you're supposed to get collagen, you're supposed to get it from animals. And by the way, not from bone broth. Bone broth has been shown to be very rich in lead, especially if you use vinegar to make it. I urge people to use what I call carcass broth. It sounds awful, but so you buy a big baked chicken, for instance, you eat the meat, you bake, right? And take the leftovers, bones, tendons, ligaments, any organs, any meat hanging on, and make broth or soup out of that, not just the bones. Because if you use only bones, and you break open the bones, so by the way, for the bone marrow, if you use only the bones and use vinegar, you're getting some collagen, teensy weensy bit of magnesium, very small amount of calcium, and a lot of lead. But that's another way to get collagen. Hyaluronic acid comes from brain and skin. Nobody wants to eat brain anymore. And I see these ladies buying boneless, skinless chicken breast, right? And paying $120, by the way, for hyaluronic acid serum, a little jar, an ounce, half an ounce, and putting it on, right? Oh, smooth it, wash it off at night, no better. So taking hyaluronic acid orally is a much more effective way for skin health, joint health, brain health, etc.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
It would be hard, Jesse, to find diseases, modern diseases, that are not either initiated or exacerbated by the microbiome. Look what we're doing with Reuteri. Reduction of skin wrinkles, vaginal moisture, boosting testosterone.